Hi, hello, welcome to Easy Nurse, where nursing education made easy. So, in this session, we'll start with the series of Lakshya 3O. So, here mainly we are discussing about the important question and answer that will be coming for your upcoming exam. So, let me start us with the 6th semester BSc Nursing Administration and the leadership, or a nursing management and the leadership. So when you're coming to this nursing management and the leadership, so when you go through these topics, mainly I'm discussing about the important question and answer, that is which type of the questions that will be coming. So when you go through it, you will be getting a good marks. Students of the 6th semester, those who are going to write for the nursing management and the leadership, please be attentive and concentrate, so you'll be getting a good marks. Let me start with the session. So first I am going to discuss with the multiple choice and the question and answer. Like a first question, it will be there like this: which of the following is not a primary function of the management? So there will be options. These are the options like a planning, organizing, staffing, providing a direct bedside patient care. So the answer is D, that is a providing a direct patient. Just a second. So the answer is providing a direct patient bedside care. That is the answer is D. The next question, it will be there like this: Henry Furlow's principle of unity of command means. So these are the options. So options are like this, first one is each employee should receive a order from only one superior. All employees should have the same job description. Then C option is the manager should delegate all authority. And the D one is team should always work independently. So the answer is A, that is each employee should receive orders from only one superior. So the next question, it will be like this: which one is not the features of management by objectives? So the options are like this: joint goal setting between manager and staff. Next one is periodic performance review against the objectives. Then next option is centralized top-down unilateral decision making, and one more is employee participation in planning goals. So the answer is C, that is centralized top-down unilateral decision making. The next question, it will be like this, that is the next question, it will be like this, that is a key role of nurse as a manager is. So you all know what's the role of the nurse manager. The options are like this, that is performing all clinical procedure personally. Then next one is managing the resources and coordinating care services. Next one is making independent medical diagnosis. Next one is writing prescription for the patient. So the answer is, that is a B, that is managing the resources and coordinating care services. So the next question, it will be like this: which leadership styles most encourages group? So that question is, which leadership style most encourages group participation and shared decision making? So the options are like this, that is a autocratic, democratic, laissez-faire, and the bureaucratic. So the answer is, that is a B, that is a democratic. So you all know, when you're coming to the democratic type of the leadership styles, encourages with the group participation and the shared decision making. The next question, it will be like this, that is a which of the following is not a correct principle of the delegation? So the options are like this. The answer is, that is a D, abdicate your accountability after delegating. So the next question, it will becomes like this: in which organizational structure do staff typically report to two managers? So the options are like this: functional, matrix, line, and the circular. So the answer is B, that is a matrix. So the next question is coming like the patient classification by acuity refers to grouping patient based on. So the options are like this: their age group, severity of the illness and nursing care needs, and one more is diagnosis, name only, and the last option is length of the stay alone. So the answer is severity of the illness and the nursing care needs. So the next question it may come like this, that is the main purpose of establishing nurse-patient ratio is. So the options are coming like this, that is maximizing the hospital revenue. Next one is ensure the patient safety and the quality of the care, reduce paperwork for the nurses, and one more option is that is increase patient admission. So the answer is ensure patient safety and the quality of the care. So this is the main purpose of establishing a nurse-patient ratio. So next question it may come like this, that is which inventory method ensure the old stock is used first to minimize expiry or wastage. As you all know, there is a what is the main inventory method they have to follow, that is the old stock is used to first to minimize expiry or wastage. So the options are like this, that is a first, the options are coming like this, that is a last in first out and the first in first out and EOQ only, and one more type is that is a ABC analysis only. So the answer is first in and the first out. So the next question it will be coming like this, that is a which of the following is not required element to establish legal negligence. So the options will be coming like this, the answer is intent to harm the patient. The next question is that is a evidence-based management in nursing means manager make decision primarily based on like a which is the evidence-based management. So options are like this, that is a tradition and the seniority only, and one more option is best available research evidence combined with the context and the expertise, and one more option is personal preferences of the administrator, and the last option is random selection of intervention. So the answer is best available research evidence combined with context and the expertise. So these are the type of the multiple choice question usually that will be coming for your upcoming exam. Please refer for more further multiple choice question and answer. You can go through with the Easy Nurse where you can able to download it from the Play Store and the Web Store. So the next question we will see, that is a which type of the long essay question that may be asking for your upcoming exam. So that important question usually that will be asking frequently, that is usually define management, explain the principle and function of management with examples related to the nursing. As first we will be discussing about what do you mean by management. So management is a process of planning, organizing, staffing, directing and controlling the human material and financial resources to achieve organizational goals efficiently and effectively. Then one more definition has given, that is a management is the art of getting a things done through and with the people's informally organized group. And one more definition I given, that is management means to manage is a forecast and plan, to organize, to command, to coordinate and to control. So these are the different type of the definition I given. Next we will look with the principles of management. So what are the main principles of the management? First one is a division of work. So when you coming to the division of work, that is a specialization increases with the efficiency, like a specialized care of the things if you want to give for the patient, especially for example like assigning the pediatric nurse to the pediatric unit, that is a division of work principle. Next one is authority and the responsibility, that is a managers must have that authority to give orders and take responsibility for the outcome. The next principle is a discipline. As you all know, as a manager should maintain that discipline, obedience and respect for rules and the essentials. Next principle is unity of command, that is each employee receive orders from only one superior. And one more principle is unity of direction, that is a one plan for one group of activity. And one more principle is a remuneration, that is a fair pay to motivate employees. Then next one is a centralization and the decentralization, that is a balance between the decision making levels. Then the last principle is scalar chain, that is a clear line of the authority from top to bottom. So these are the principles of the management. Next we will see what are the main functions of the management, that is a planning. So when you're coming to the planning, setting objectives and the decision action or a deciding actions. For example, like preparing the duty roster or a patient care plans. Next function is organizing, that is arranging the resources and the work structure. Next one is staffing, so recruiting and assigning the nurses according to the workload. Then next one is directing, that is guiding and motivating the nursing staff. Then last function is controlling, that is evaluating the performance and correcting the deviations. So these are the main functions of the management. Next question or a next topic, when you're coming to this important question, it will be there like this, that is a define leadership, discuss the qualities and the styles of an effective nurse leader. So when you're coming to the leadership, so you all know what you mean by leadership. Leadership is the ability to influence, guide and motivate the others towards the achieving a common goal. So when you're coming to the qualities of a good leader, so when you're coming to the qualities of the good leader, it will be like she should have the proper good communication skills and integrity and the honesty. Emotional intelligence is the most important for a good leader, and decision making ability she should have, and empathy and the understanding. Self confidence should be there, and responsibility and the accountability. And the one more quality is vision and the creativity. Next we will see which are the styles of the leadership. When you're coming to the different styles of the leadership, as you all know, that is a different type of the leadership: autocratic, democratic, laissez-faire, transformational leadership, and one more is a transactional leadership. What will happen with this autocratic leadership? That is how she is going to manage as a autocratic leader. So the leader who will be there with the autocratic leadership qualities, she should have that leader making a decision by alone. So by herself she is going to make the decision alone, useful in an emergency situation. Example, when you take like a disaster management. Then one more type is a democratic. So here what will happen? Usually the leadership skills, it will be coming with the participative, that is a staff participation in a decision making, it will be there. So promote with the team spirit and the satisfaction. Then one more type of the leadership, that is a laissez-faire, that is a free reign, it will be there. That is a leader gives freedom, minimal interference, it will be there, effective with the highly skilled teams. Then one more is a transformational leadership. Here what will happen? Usually inspires the staff towards the innovative and the excellence. And one more is the transactional leadership. It is mainly based on the rewards and the punishment. So these are the different styles of the leadership. For further explanation, you can visit the Easy Nurse, that is you can go through with the Easy Nurse, where you can able to download it from the App Store or a Play Store. Then one more topic, that is a type of the question, it may asking like explain the process and the principles of staffing in a nursing services. So what do you mean by staffing? So staffing is a process of determining and providing the required numbers and mix of the nursing personnel to meet the patient care needs. So there will be coming to the process of the staffing, that is a workload assessment. So when you're coming to this workload assessment, they should determine the number of the patient and the care needs. Then one more process that is a planning, that is mainly determine the required number of the nurses per shift, that is based on the how many patients are admitted in a hospital or how many bedded hospital. On the basis of that, they are going to determine the required number of the nurses per shift. Then one more is a recruitment, that is a recruitment is the most important for giving a care for the patient, that is attracting the qualified nursing personnels. Then selection, so usually the selection, it will be based on the screening and appointing the suitable candidate for the particular task. Then placement and the orientation, so usually assigning the duties and introducing the policies for the staff. Then one more is the supervision. It's the most important, that is a guiding the staff during the work. Then evaluation, that is a assessing the performance of the each employee, those who are working in an organization. So this is about the process of the staffing. Then one more is the staff development. So as a staff, those who are working in an organization, staff development is the most important, that is providing with the in-service education and the training to develop their knowledge and the skills. Then which are the main principles of the staffing? So when you're coming to the principles of the staffing, keep it in the mind, that is a adequate number as per the INC norm. So INC norm, when you're coming to the, for example, 1:6 in a general ward and in 1:1 in a ICU setup. So right person for the right job is the most important when they are going to select the staff, and the equity and the fairness. And one more principle is professional growth and the continued education. Then last principle is effective supervision and the motivation of the staff. Then next one, it will be there like a define supervision, discuss the technique of the supervision with the suitable examples. So when you're coming to the supervision, what do you mean by supervision? Supervision is a process of guiding, directing, observing and evaluating the performance of the nursing staff to ensure that nursing care is delivered effectively according to the established standards. So one more definition I given, that is a supervision is a process of overseeing the work of the subordinate. Like the superior who will be there, he is going to oversee the subordinate. That is what are the tasks or work the subordinates has completed or not. The supervisor giving the direction. So along with that, ensuring that that work is done as per the standards of the organization, whether the objectives as met according to the standards of the organization. Next, we will see what are the main objectives of the supervision. So, the main objective of the supervision, that is to maintain and to improve the quality of the nursing care, to ensure the adherence to the hospital policies and the standards they have met or not, and to promote the staff development and the motivation, to identify and solve the work-related problem. And one more is to ensure the effective utilization of the resources. So these are the objectives of the supervision. Then which are the main techniques of the supervision? That like a superior or a supervisor who will be there, how they are going to use which are the techniques while supervising with the subordinate. First one is a direct supervision. Here what will happen, as a supervisor who will be there, they are going to observe the staff performance with the nursing procedure directly. That is, for example, when you're coming with the administration of the medication, like how the nursing staff administering the medication, the nurse supervisor who will be there, observe how the IV infusion they are going to give for the patient as when you're coming to the hospital setup and all. Then one more is the conferences and the meeting. So usually here what will happen, the regular discussion it will be there between the supervisor and the staff to review the work schedule and the share their experiences and the solve their problems, what and all it will be there they come across with the organization. So this is how they are going to make with the conferences and the meeting with the technique of the supervision. And one more is a demonstration and the teaching. So as the demonstration of the teaching, what it will be there, usually superior as they are going to demonstrate particular task of the work and correct the procedure and encourages the staff to practice. So usually what will happen, this is in the nursing colleges, as the teachers they are going to demonstrate the particular nursing procedure, students has to demonstrate. So that is what they are going to looking with the particular student. Then one more technique is a written report and the record. Like a nursing staff, those who have made the mention of the recording and the reporting, over with that also the supervisor will be observing with the subordinate. That is a reviewing of the reports, nursing notes and the documentation to monitor care quality, like how the quality of the care they have given for the patient. Then other technique of the supervision is a checklist and the performance appraisal. So when you're coming to this checklist and the performance appraisal, usually they are going to using with the checklist to evaluate the perform against the standards. Then one more is a feedback and the counseling. Usually here they are providing the constructive feedback and guidance to improve the performance. Usually like for example, discussing with the nurse how to improve the communication with the patient. Then last technique of the supervision is a round supervision. So here what will happen, usually the supervisor makes the ward round to monitoring with the nursing activities, patient condition and the staff needs. For example, like a nursing superintendent that will be making with the morning rounds in all the units, like what are the main requirement, it will be there according to the unit wise of the staff. Then we'll see what are the main qualities of the good supervisor. Like if the supervisor who will be there, what are the main qualities they should have? That is a good communication and the leadership skills they should have. They should have that fairness and the objectivity and the professional knowledge, and they should have that patience, empathy, ability to motivate the staff. So for the further explanation, you can visit with the Easy Nurse, so where you can able to download with the App Store and the Play Store. So the next question, it will be there like this, that is discuss the role of the nurse manager in the recruitment and selection of the staff nurses. So what do you mean by recruitment? So you all know recruitment is a process of attracting the suitable candidate for the employment, whereas selection that will be involving with the choosing the most qualified individual for the job. So when you coming to the role of nurse manager in the recruitment, like what's the role they should have as a recruitment process? So identifying the staffing needs. So if any organization is there, they have to assess the number of the nurses required based on the workload and the patient acuity. Then manpower planning. So manpower planning, that is estimate the number and the type of the nursing personnel needed for the present and the future requirement. Like at present how many requirements should be there, and in the further future how many requirement they need. That is also they have to look for the manpower planning. Then one more is preparing the job description and the specification. It should be very clear, that is defining the roles and the responsibility and the qualification of the staff nurses position. Like a different position of the staff nurses, it will be there when you coming to the hospital setup, in a college organization also. When you coming to the hospital setup, like a staff nurse, what's the qualification they should have and how many years of the experience they should have, and when you coming to the ward nurse, like what's the qualification they should have and how many experience they should have. All these things they should mention, that's a proper job description according to the particular post and the advertising vacancy. Like helping in a drafting the advertisement, either it may be they can able to give an advertisement with the newspaper or a job portal with the different areas and the nursing colleges, and screening application. So usually reviewing the resume to shortlist eligible candidate. So these are the role of the nurse manager in a recruitment process. Next we will see what's the role of nurse manager in a selection. Like once the selection process, it will be coming, what's the main role of the nurse, it will be there. So the first one is participation in a interview board. That is usually what will happen, the nurse manager who will be there, they have to assist in interviewing the candidate to assess the whether they have the clinical knowledge, communication skills and the attitude. All these things they have to check, and administering the selection test. Like they may conduct the written or a practical test to assess with or to evaluating with the nursing skills, and references and the backboard checking, that is verifying with the credential, licensure and the previous work performance, like a way they have done the working performance, whether in a clinical setup, all these things they have to check it out. And the final selection and the recommendation. So that is a recommendation, they should be must suitable candidate to the higher authority or a HR department. Then last one is orientation and the induction. So usually organizing the orientation program to the newly appointed staff as to familiarize them with the hospital policies and the units. So these are the role of the nurse manager in a selection. Then what are the main qualities needed in a recruitment or a selection? they should have that fairness and the impartial judgment. And one more is that is a awareness of the professional standards. And one more thing that they have to keep it in the mind, knowledge of the legal and the ethical aspect of the employment. Next we will look with the short essay, like which type of the short essay they will be asking. First one, it will be there like this: explain the principles of the budgeting. So when you're coming to the budgeting, what do you remember budgeting? So budgeting is a process of preparing a financial plan that estimate the income and the expenditure for a specific period to achieve the organizational goal efficiently. So this is what they are going to make it out with the like how they are going to estimate the income, that is, and the expenditure for a specific period of the time. So when you're coming to the principles of the budgeting, that is the first one is a planning principle. So when you're coming to the planning, like how the budgeting planning they have to make it out. So budgeting should be based on a clear objective and the future plans. So they should have that in the mind, that is it should be with the based on the clear objectives, and they have to look with the future plans also. For example, planning the budgeting for the nursing education or a patient care supplies when you're coming to the hospital setup. Then one more principle is a flexibility principle. So when you're coming to this flexibility principle, the budget should allow the modification according to the changes with the circumstances. Like it should be flexible as according to the circumstances. Then one more is a participation principle. So as all the department heads and the staff should be involving in preparing with the budget to ensure the accuracy and the cooperation. Then one more is the accuracy principle, that is estimating the income and the expenses. So the income and the expenses should be realistic based on the reliable data. So these are the principles of the budgeting. Then one more principle is a comprehensive principle. Comprehensive principle here usually what it will be there, that's a budget should be cover all the aspect of the nursing services. That is, it should be involving with the manpower, equipment, material and the training. So with the comprehensive area of the budgeting they have to prepare. Then one more is a control principle. Control principle means usually the budget act as a tool for the monitoring and the controlling of the financial performance to avoid with the overspending. Then accountability principle, as you all know budgeting, that is how the income and the expenditure it may be happening. That is each and every department and the individual, everyone should have that accountability, are responsible for the fund to ensure that proper use and the reporting. So these are the principles of the budgeting. Next we will see, describe the role of the nurse manager in maintaining the public relation. Like the nurse manager who will be there, how they are going to maintain that public relation. So the public relation, it refers to maintain a good relationship between the hospital, staff, patient and the public to create a positive image. Then coming to the role of nurse manager in coming with the public relation, like if the nurse manager who will be there, how she has to maintain that manager relationship with the public. In a public, how she has to maintain, that is the first one is a communication. That is, she act as a link between the hospital, administrator, patient and the community. So that communication skills she should develop, that is with the public relation in coordinating with the different peoples when she come across with the patient relatives, hospital setup and the different departmental heads, everyone. That is providing with the accurate information to public about the nursing services. Next one is a patient relation, that will be ensure that patient satisfaction by promoting the quality care, empathy and the responsiveness. Then one more is a community relation. So the nurse manager who will be there, they should have maintained that's a participation in the health education and awareness program in a community setup. And one more is a staff relation, as maintaining with a good interpersonal relationship among with the nursing personal staff and the doctors and other departmental heads. Then one more is a media relation. So when you're coming to with this media relation, they should have the coordinate with the media, especially during the time of the health events or awareness program when they are going to conduct, and ensure with the positive hospital representation. Then one more is a complaint management. So when you're coming with this complaint management, handles the patient and the family's grievance tractfully and ensure with the timely resolution. So these are the role as a nursing manager she is maintaining with the public relation. For the further explanation, you can visit with the Easy Nurse, where you can download it with the App Store and the Play Store. The next question, it will be there like this, the performance appraisal. So this performance appraisal is the most important question that will be asking frequently in a nursing management and the leadership. So what do you mean by this performance appraisal? Performance appraisal is a systematic and the pediatric evaluation of the performance of nurses or a nursing staff in relation to their job responsibility and the organizational goals. So when you're coming to the main objectives of this performance appraisal, so the nurses or a staff who are working in an organization, we have to appreciate with the each and every performance what they have done. So what are the main objectives of this performance appraisal? First one is assess the job performance of the nursing personnel. Sorry, one second. Okay, first one is assess the job performance of the nursing personnel, and one more is identifying the strength and the weakness of the staff. Then one more objective is provide the feedback for the professional growth. Then one more objective is assist in promotion, transfer and the salary increment. So it will be help for the promotion, transfer and the salary increment of the each and every employee, those who are working in an organization, and determining the training and the developmental needs, like whether the particular staff need extra training, their knowledge we have to develop with the skills, everything we have to determine and improve the quality of the nursing care and enhances with the motivation and the job satisfaction of the staff nurses, those who are working in an organization. Then which are the main methods of the performance appraisal? As you all know, there is two methods we have divided here, that is a traditional method and the modern method. When you coming with this traditional method, under the traditional method there is a different type of the performance appraisal. First one is a checklist method. So when you coming to the checklist method, here mainly we are going to do whether yes or no, the question about their performance, whether they are doing it in a better way or not, yes or no questions it will be there. And the rating scales, usually the rating scale on a scale, usually that is a 1 to 5 for the various skills are tried what we are going to make the performance appraisal. And one more method is a SA method. So usually the superior or the nursing staff, the head of the department will be there, they are going to write a descriptive report on the performance of the each and every staff, those who are working under her. And last method is critical incident method. So usually what they are going to do here, recording the specific good or a poor incident what they have done. So these are the traditional method of the performance appraisal. When you're coming to with the modern method of the performance appraisal, that is the first one is a management by objective. So MBO, what we are going to call it as that is goals are set jointly by the supervisor and the nurses. Perform is measurable by goal achievement, like a particular goal achievement they should be done within an organization, like according to meeting the standards of that particular organization. If they met, so their performance like appraisal they are going to do on the basis of this management by objective. And one more is a 360 appraisal. 360 appraisal means you all know that is a feedback they are going to collect from the peer, subordinates, patients and the supervisor. That is a 360 in all the area of the developmental aspect of the how the nurse is doing a work. That is what they are going to do with the 360-degree appraisal method. And one more is a behaviorally anchored rating scale. So usually here what they are going to do, that is a combines with the quantitative and the qualitative assessment using with the behavior example. Then the last method is a peer review. That is what they are going to evaluation by the colleagues of the similar rank, like the colleagues, if subordinates, if the ward manager will be there, they are going to take with the peer review. Along with that, a nursing tutors or a nursing staff or a nurse manager who will be there on the basis of the same colleagues with the similar rank wise ratings who will be there. So they are going to take with the colleagues evaluation. So these are the different method with the traditional method and the modern method of the performance appraisal. Next we will see one more question. It will be there like this. That is an important question. So the nursing rounds. So nursing rounds, you all know what's the meaning of the nursing rounds. Nursing rounds are the method of evaluating and improving the patient care. So where the nurses along with the nursing students or a supervisor visit the patient at the bedside to discuss their condition, treatment and the nursing care, what they are going to give for the patient in a day-to-day activities if the patient is admitted in hospital. So the main objectives of this nursing rounds are to evaluate the quality of the nursing care provided, to identify the patient needs and the problem, and one more is to provide the teaching and the learning opportunity for the student nurses, and to promote the teamwork and the communication among with the staff nurses, and one more is to improve the patient satisfaction and the outcome. Then there is a different type of the nursing grounds, that is a informative and the giving grounds. So usually here what will happen, the exchange of the information about the each patient, it will be there between the nursing staff, nursing manager or a nursing personnel who is going to allotted for that particular patient, and the instructional or a teaching grounds. Here usually they are conducted for the nursing student to learn. Then one more is a problem solving grounds. Usually it is mainly focusing on the identifying and the problems. Usually here what will happen, focuses on the identifying and solving the patient problem. So if the patient is come across with any problems, usually the nursing manager or a ward nurse or along with the nursing staff who is allocated, they are going to solve the problem. Next, what are the main advantages of this nursing grounds? That is, first one is improve the quality of the patient care, it will be there, and encourages with the learning and the critical thinking. One more is promote the teamwork and the communication, and one more is the providing the immediate feedback and the guiding to the staff. The main limitation of this nursing round, that is, it is a time consuming in a busy ward. So as with the visiting with the each and every patient, it will be taking a lot of time and may disturb with the patient rest. Along with that, one more limitation is required a good planning and the leadership. Then role of the nurse manager in maintaining the disciplinary problems. Like as a nurse manager who will be there, how she is going to maintain the role in a disciplinary problems. So when you coming to the meaning of the discipline, so what do you mean by discipline? Discipline means that is a rules, regulation and the professional ethics to maintain order and harmony in a workplace. So when you're coming to the role of the nurse manager, like if the nurse manager will be there, how she is going to maintain that disciplinary action, like how she is going to take as a disciplinary action manager role. That is, she has to maintain or setting the standards. That is, setting the standards is the most important. That is a clear communication rules and the behavioral expectation, like what the behavioral expectation and what are the rules and regulation each and every staff they have to maintain within the organization. Observation, that is a identifying the early sign of the misconduct, like if the staffs are taking many absenteeism or any negligence you come across with the any staff. And the one more is a investigation, that is a collect the fact before taking a action. That's the most important. And counseling and the guidance, like if the any staff who are not maintaining the proper discipline, you have to discuss problem privately and offer with the corrective advisors. And one more is a correction action, so that is a corrective action, that is a issue with the warning, like if they are going to do any misconduct means by that time itself you have to issue the warning and the suspension. Along with that you can report with the higher authority if it is needed, and the documentation, that is maintaining a record of the disciplinary action for the future references, like further references you can come across with that particular documentation of the employer. And the prevention, so prevention means that is promoting with the positive motivation, training and the supervision, you can able to prevent most of the misconduct or if they are not maintaining the proper disciplinary action within the organization. So these are the role of the nurse manager as a disciplinary problems. Then one more, it may come across like the question, it will be like this, that is a job description for the staff nurse in a intensive care unit. So either any job description of the particular staff or nursing personal staff, it will be there, like the staff nurse who are working in a ICU setup, or a job description of the principal in a college organization, or a job description of the nursing superintendent. Any type of the question they may be asking. So here I am going to discuss about the job description of the staff nurse in a intensive care unit. So usually the job title, it will be coming like a staff nurse in a ICU setup or a intensive care unit. So the staff nurse who will be working in a ICU setup, they have to report with the nurse manager or a ward in charge who will be there, and the department it will be there, that is a critical care unit. So what's the main job description of the staff nurse, those who are working in a critical care unit? First one is patient care responsibility. So that the nurse who will be working in an intensive care unit, they have to monitor the vital signs, administer the medication, maintaining with the ventilators and the infusion pumps, and providing the emergency care, especially in a critical situation, and maintaining with the aseptic technique or during all the procedures. Then documentation. So documentation here, usually the nursing personnel who is going to give care for the patient, they have to record the each and every patient data, intervention, what she has done, along with that outcome accurately in a chart. Then equipment management. As you all know, in the intensive care unit there will be many equipment, emergency equipment, it will be there. She has to check and maintain the ICU equipment such as monitor, suction machine and the defibrillator, everything. Coordination. So she has to work with the doctor, physiotherapist, lab staff for the holistic patient care. And the education and the training here, the educate the patient relative on the procedure and the progress of the patient, what the care they are going to give. Safety and the infection control, follow with the infection control protocol, that is ensure the safe environment of the patient care, along with the she can able to take care by herself. And the reporting, so report changing with the patient condition by to the physician immediately, what it will be there, she has to give the proper communication with the physician. So these are the job description of the staff nurse, though she is she is working in a intensive care unit. So the next question it may be asking like explain the technique of the inventory control. So you all know what's the meaning of inventory control. Inventory control means that is managing and maintaining the optimum quantity of the material to ensure the smooth functioning and avoid the shortage or a wastage. So there is a different technique of the inventory control. That is the first one you all know, that's the ABC analysis. So usually the items though which we are going to categorize over on with the ABC analysis, that is a ABC. So in the ABC category, like in different category, like coming to the A, like usually we are going to choose with the high cost low quantity item. For example, ventilator we are going to categorize. In coming to the B analysis, that is a moderate cost and the quantity item, usually example like a syringe we are going to analyze. And the C is the low cost high quantity item, for example like a cotton or a gloves. Then one more is a VED analysis, here based on the critically. VED, when you coming to the VED, V means that's the vital items, life saving drugs, and the V means essential items, and the D is a desirable items. Then one more type is a FIFO, that is a first in and the first out. Usually what will happen here, whole stock is used before new stock to avoid with the expiry and the wastage. And the reorder level method, usually here what will happen, a specific stock level at which new order must be placed to prevent with the shortage. And one more is a economic order quantity. Usually here what will happen, determining the most cost effective quantity to order with the each time. And the last type is a perpetual inventory system. Usually here what will happen, continuous recording of the stock movement, like how the stock movement it will be happening in each ward in a hospitalization organization. They have to check it out to know the balance at any time. Then coming to the next topic is a nursing audit. So what do you mean by this nursing audit? It's a nursing audit is a systematic and formal examination or a reviewing of the nursing records and practices to evaluate the quality of the nursing care provided to the patients. So when you're coming to the objectives of the nursing audit, to assess the quality of the nursing care to provided to the patient, to evaluate the effectiveness of the nursing services, to identify the strength and the weaknesses in nursing practices, to promote the accountability and the professional growth among with the nurses, to improve the patient care standards and the hospital efficiency, to provide the basis for the staff evaluating and the training. Then coming to the different type of the nursing audit, that is a concurrent audit, retrospective audit, and one more is a prospective audit. So what do you mean by this concurrent audit? So usually it will be done while the patient are still in a receiving care, like the patient will be present at the time of the receiving a care in a hospital setup, help identify and correct the problems immediately what we are going to give care for the patient. For example, like observing the IV fluids administering during the time of the rounds. And the one more type is a retrospective audit. Retrospective audit means we are going to look back, that is conducted after the patient is discharged. Like if the patient is discharged only, we are going to do this retrospective audit by reviewing with the records and the reports. For example, like reviewing the nurses notes for the completeness and the accuracy of the what the care we are going to give. And the prospective audit is done before the patient care is going to give one, that is by setting the standards and the guidelines. For example, like developing the checklist for the surgical ward procedures. So this is the types of the nursing audit. Then which are the steps that will be involving with the nursing staff audit process? So first one is establishing the standards, that is they have to maintain the what constitute good nursing care they are going to give. Then one more is collecting the data, that is usually reviewing of the nursing records, reports, or observing the care practices what we are going to give, and the analyzing the data, that is usually compare the actual performance with the established standards and identify the deficiency. Here we have to note the gap or a deviation from the standards and the implementing with the correction action. So usually what will happen, plan measures for such as they can able to take with the training, supervision, or a policy revision. And the last step is or a last process is re-evaluate, that is conduct with the follow up with the audit to check with the improvement of the patient care. So these are the steps in a nursing audit process. Then what are the main advantages of this nursing audit? Ensuring that quality assurance in a nursing care. And one more is identifying the area of the staff improvement, like which area of the staff improvement we can able to make it out by giving a proper patient care, and promote the accountability and the documentary accuracy of the each and every staff for the better patient care, enhances with the patient satisfaction and the safety is the most important. And one more advantage by doing with this nursing audit, what will happen, it provides with the data for the research and the policy making. The main limitation of this nursing audit is it will be like a time consuming and the labor intensive, and the relies heavily on the accuracy of the nursing records. And one more limitation, it may cause anxiety among the staff if not conducted positively. So these are the limitation of the nursing audit. So for further explanation, you can go with the Easy Nurse, where you can able to download it with the App Store or a Play Store. Then one more question, it will be there like define in-service education program and explain the components of the in-service education. So what do you mean by this in-service education? So in-service education is a planned educational program conducted within the healthcare organization for the nursing staff who are already employed, like already the staff, it will be there in a particular organization. We have gone to update their knowledge, skills, attitude for the better patient care. So what are the main purpose of this in-service education? To improve the quality of the nursing care, to update the nurses with the current trends and the technologies, like whatever the new technologies that is upcoming, and to develop the leadership and the managing skills, and to increase the job satisfaction and the motivation within the employees. Then what are the main components of the in-service education? That is, you can able to give the in-service education either through with the orientation program. So when you coming to the orientation program, usually we are going to conduct it for the newly appointed employees. Like we can able to give introduction about the hospital policies, rules, duties, and the organizational structure, everything, and the induction training. So usually here we are going to provide the initial training about the work procedure, safety, and the infection control, and continue education. So continue education is the most important for each and every staff nurses who are working in an organization. So regular educational session that will be updating with the professional knowledge along with that skill training, like a hand-to-hand training to improve the clinical and the technical skills. For example, like use a new medical equipment or a procedures if it is any new upcoming it is happening, and the supervisor and the leadership training that is developed with the proper communication management and the supervision skills among with the senior nurses. And one more is a refresher courses, like it will be enhancing with the new courses with a particular employees, those who are working in an organization, like a short-term program or a renewing, or they may able to do it with the reviewing of the nursing knowledge after with the long practices. So these are the components of the in-service education. For the further explanation, you can go with the Easy Nurse, where you can able to download it with the App Store or a Play Store. Then one more is a staff welfare committee. So staff welfare committee is responsible for the planning, implementation, and the monitoring with the welfare measure for the employee to ensure their physical, mental, social, professional well-being. So what are the main objectives of this staff welfare committee? That is to promote the employee health and safety, then to provide with the welfare facilities such as like a restroom, canteen, or a uniforms, etc., to resolve the grievance related with the working condition. And one more is to ensure with the work-life balance and the stress management, to arrange the recreational, cultural, motivational activities. And one more is to ensure the compliance with the labor laws and the welfare policies. So these are the objectives of the staff welfare committee. Then coming to the very short answer, like which are the very short answer they are going to ask for the upcoming exam. Usually they'll be asking like a define nursing standards. If they are asking a define nursing standards, you are going to give the proper explanation. That is a nursing standards are a criteria or a bench makers that defines the level of the care, professional performance, and the behavior expected of the nurses to ensure the safe and the quality patient care. So for the further explanation, you can go with the Easy Nurse. You can able to download it with the App Store or a Play Store. So we have given a proper explanation about this nursing standards. Then define the tort. So when you coming to the tort are the civic wrong committed against a person or a property for which injured party can claim the legal damages. For example, like if it may be happen like a negligence or a assault or a defamation in the nursing practices. Then define the telenursing. So what do you mean by this telenursing? Telenursing is a use of the telecommunication technology to provide the nursing care. Like with the use of the telenursing technology, usually we are going to give the nursing care to the person or a patient, consultation, education, and the monitoring to the patient remotely, like with the remote setup of the patient, like staff nurse will be there in a hospital setup, but the patient will be there in a home setup only. With the use of the telecommunication technology, they are going to give care for the patient. For example, like which type of the care they are going to give, with the telephonic follow-up, they are going to give about the diabetic patient, like health education they might be giving, or maybe based on the video based patient education also they are going to give with this telenursing. Then write any 4 INC standard of the nursing practices. So first one is assess the patient health status and planning and implementing with the individualized care, evaluating of the patient outcome, and last one is maintaining the professional ethics and the accountability. So these are the INC standards of the nursing practices. Then list the legal safeguard of the patient rights. So what are the main patient rights? Like if the patient is admitted in a hospital, what are the patient rights? It will be there. That is a right to informed consent before any treatment. Then right to confidentiality and privacy of the medical records. Then one more question, it will be there like this, that is a define clinical rotation. So what do you mean by this clinical rotation? Clinical rotation is a systematic movement of the nursing student through the different hospital department to gain the practical experiences in a various specialty during their training. As you all know, students are going to get the nursing practices training in a hospital setup. So when they are going to the hospital setup, we have to make that clinical rotation. So this is what the systematic movement of the nursing students through with the different hospital department. So with the different hospital department, as we are going to assign the student nurses. Then one more question, it will be there like a collective bargaining. So what do you mean by this collective bargaining? Collective bargaining is a process of negotiation between the management, that is the employer, and a group of the employees. So group of the employees means usually here what will happen, it is represented by any union to reach an agreement to the working condition, wages and the hours, benefits and the other employment terms. Then one more question, it will be there like this, that's the list any 4 steps to reduce the turnover in a hospital. Like how we can able to take the step to reduce the turnover of the employee in a hospital setup. That is, provide the job satisfaction, offer the competitive salary for the staff nurses, those who are working in a hospital setup, improve the work environment, along with that encourage for the career development in a future. So these are the steps we can able to take to reduce the turnover of the staff nurses working in a hospital setup. Then one more is a non-malefficiency. So what's the meaning of this? Non-malefficiency means that is a ethical principle that is usually not causing harm to the others. That is what we have to keep it in the mind. So like this type of the very short answers they might be asking in your upcoming exam. So for further explanation or further questions, you can able to visit with the Easy Nurse, where you can able to download it with the App Store or a Play Store. So keep learning, keep exploring with Easy Nurse, study with the Easy Nurse, so you will be getting with the more marks. Thank you.